card, and I'm going to do a 360 of my room. Thank you. My name is Nancy Namdi, and I'm going to be your nurse for today. First of all, I'm going to sanitize my hand. Also, for the purpose of this video, I'm going to just clean out my stethoscope. I've done this before, but for the purpose of this video, I'm going to clean it again. My name is Nancy Namdi. I'm going to be your nurse for today. Please, can you tell me your full name and your date of birth, please?
Josephine Agbolade.
Okay, I'm just going to confirm I have the right patient. Thank you. Today, I'm going to be doing a head-to-toe assessment. The purpose of this assessment is to check your overall health. If you have any questions, feel free to ask me as we go on. Do I have your permission to go ahead with this procedure?
Yes.
Okay. Do you have any pains?
No.
Allergies?
No.
Need to use a washroom?
No.
Thank you. I'm going to draw the curtains for privacy. Okay, so my patient is alert, and she's oriented to person, place, and time. She responds appropriately. Can you give me your full name again? Tell me where you are to this date, please.
Josephine Agbolade, we are in your head-to-toe assessment. The date is November 17, 2025.
Okay, thank you so much. So like I said, my patient is alert and oriented to person, place, time. Her appearance looks clean, she's well grown. I don't perceive any odors. And her body structure, her weight and her height are proportionate. Her body structure is symmetrical. Patient appears well nourished and there are no visible signs of deformity. Her posture is upright. Her shoulders are symmetrical. There are no signs of discomfort or pain or any abnormal curvatures or deformities. Can you walk a few steps forward for me and come back to your seat, please? Thank you. Camera, come close, please. Okay, so as you can see, my patient's gait is steady. Her movement is smooth. There are no abnormal or involuntary movements noted. Okay, her facial expression is relaxed. Her age matches her looks. There are no signs of distress, anxiety, sadness. Her facial symmetry is okay. Her skin tone is consistent with ethnicity. There are no rashes, no lesions, no jaundice. I'll check her eyes. Okay, so there are no lesions, no pallor, no sinuses observed from a distance, and her behavior is calm and cooperative. Her speech is coherent. Her behavior is appropriate to the situation, and she maintains eye contact. I'm going to be assessing the head. Our patient is normal cephalic. There are no swellings, no edema, no abnormal curvature of the head. Her facial symmetry is good. Now I'm going to be checking her cranial nerve 7, which is the facial nerve. Can you smile for me, please? Can you frown? Okay, I'm going to try to open your eyes while you close it shut. Don't let me open it. No, can you close your eyes, please? Just one. Okay, I couldn't open eyes, so I would say there's no weakness noted. Her nasal passage is midline. I'm just going to assess. Okay, there's no discharge from her nose, and her nose is well proportioned, is in the center of her face. I'm going to do the whisper test now. I'm going to whisper into your ears, and I need you to repeat for me what you hear.
Apple. Papa. Window.
Okay, I'll try the other ears as well. Okay, she could say everything that I said to her. Okay, I'm going to be assessing her eyes. I didn't check her pupils. Okay, pupils are round. They're about 2.5 mm in size, and they're both round, equal, bilateral. I'm going to introduce the light from the side of these eyes. Can you open your eyes, please? Okay. Okay, when the light hits her eyes, I see the constriction, and also the other eyes responds appropriately. I'm going to assess the mouth now. Okay, so please, I'll need you to open your mouth. I'm going to depress your tongue with this. When I do that, I need you to say, ah. Okay, so I noticed the volar and the soft palate rose when she did the ah sound. So the inside is pink and moist, and everything seemed normal there. Thank you. Now I'm going to be assessing your skin. Can I see your hands? The skin of her arms are smooth. I don't see any lumps, bumps, scars, or lesions or abnormality. The color matches her ethnicity. And I'm going to palpate now. I'm going to palpate for temperature. I'm going to palpate for pain. Do you feel any pain? No. Turgor is okay. I don't see no scars. It's smooth to touch. It's dry and it's also warm to touch. I'm going to be checking her radial pulse. Her radial pulse is strong. It's regular, equal, bilateral, and it's about 60 to 100 beats per minute. I'm going to check her brachial pulse. Her brachial pulse is strong. It's equal, bilateral. I would say it's about 2+, and it's about 60 to 100 beats per minute. Can you show me your hands like this? I'm going to check the capillary refill. It's less than 3 seconds. Okay, can you squeeze my hand, please? Okay. Her strength, I'll give it a 5. She has a good strength in her arms. Thank you. I'm going to assess your legs, please. The lower extremities. Okay, so it's okay. I'll do that. Okay, so I see the equal distribution of hairs on her leg. The leg looks smooth looking at it. Color matches her ethnicity. There I don't see any wetness. I don't see any scars. I don't see any swelling, no edema. So I'm going to palpate the leg. So I'm palpating for temperature. It's warm to touch. It's dry. Do you feel any pain? Okay, there are no pains and it's smooth to touch. There are no edemas and I don't see any inflammations, no signs of inflammation in the joints. Thank you. Can I take off your shoes? Thank you. I'm going to be assessing the dorsalis pedis. The pulse is strong and equal bilateral, about 2+. It's about 60 to 100 beats per minute. And I'm going to check in the dorsalis pedalis. I'm going to check in the posterior tibialis, the posterior tibialis. The pulse is strong, 2+, about 60 to 100 beats per minute, and it's regular, equal, bilateral. I'm going to be checking the capillary refill on her feet. It's about less than 3 seconds. Okay, thank you. We're going to be doing I'm going to sanitize my hand now. We're going to be doing the range of motion on the leg. Okay, can you do the, can you stand up please? Can you do the flexion of the leg, extension? The other leg too, flexion, extension. Can you do rotation of the leg? Do you feel any pain? No. Can you do the, dorsiflexion? Can you point your toes down? Plantar flexion and dorsiflexion. Thank you. Do you feel any pain? No. No. Okay. We're going to do the range of motion of the hand. I didn't do that earlier. Can you do a flexion of the elbow? Can you do extension? Thank you. Can you do the circular movement, internal rotation, and do the external rotation? Thank you. Can you do this? Can do the supination? Okay. Can do the radial deviation, ulnar deviation? Okay. Do you feel any pain at all? No. You sure? No. Okay. My patient said she doesn't feel no pain, so there are no pains, no crepitation. She was able to complete the full range of motion exercise. Thank you. You can sit, please. Okay, so now we've done that. I'm going to listen to her breath sound, which is the lungs. I will need you to please turn around so the camera can see us clearly. I'm going to hold the chair. You move your legs that way. Okay, good. Thank you. Thank you very much. Okay. I'm going to need you to lean slightly forward with your hands on your thighs. Okay, when I change the position of the stethoscope, I'll need you to breathe in and out. First of all, I'm going to palpate. Do you have any pains?
No.
Okay, no tenderness, no pains. Skin looks smooth and it's warm to touch. Okay, so I'm going to auscultate now. Can you breathe in and out? Thank you. Breathe in and out. Okay, in and out. Okay, breathe. 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 Okay, thank you. Her breath sound is clear, it's normal. I didn't hear any wheezing. I didn't hear any crackles as well. So thank you. Can you turn to your front, please? Okay, so I'm going to be checking for a heart sound. Okay, I'm going to be doing that with the diaphragm of the stethoscope. First, I'm going to look at the landmark of Lewis. And to the right, which is the second intercostal space, right sternal border. Okay, to the opposite side, that's the aortic valve. Now to the pulmonic valve, which is the opposite side, second intercostal space, left sternal border. Now I'm going to move down to the Erb's point, which is the third intercostal space. Okay, now I'm going to move to the tricuspid, which is the fourth intercostal space. Now I'm going to move to the mitral, which is the fifth intercostal space. Okay, so S1 is loudest at the apex, and S2 is loudest at the base of the heart. Now I'm going to check for extra heart sound using the bell side of the stethoscope. First, I'm going to look at the landmark of Louis, second intercostal space, right sternal border. That's the aortic. Now I'm going to move to the pulmonic, which is the opposite side, second intercostal space, left sternal border. Now I'm going to move to the Erb's point, third intercostal space. Now I'm going to move to the fourth intercostal space, which is the tricuspid. And I'm going to move to the fifth intercostal space, which is the mitral. Okay, there are no S1, S3, and S4, and there are no murmurs. Thank you very much. Now I'm going to assess your abdomen, your stomach. If you can lie for me here. I'm going to drape my patient appropriately. Thank you. Okay, look, assessing the stomach look smooth. There are no discolorations. Her color matches her ethnicity. There's no scars, I don't see lumps, bumps. So if you look closely from the side, the surface is flat. So now I'm going to auscultate. I'm going to use the diaphragm part of my stethoscope, and I'm going to start from the right lower quadrant. Move up to the top right quadrant, then to the left upper quadrant. This is clockwise. And to the lower left quadrant. Okay, grumbling sounds noted on all 4 quadrants within about 5 to 10 seconds of listening. Now I'm going to do a light palpation. Do you feel any pain?
No.
Any discomfort?
No.
Okay. So I don't feel any lumps or bumps, and patient said she doesn't feel any pain. I'm going to now put my right hand underneath, and with this hand I'm going to check for to feel the liver, kidney, the internal organs. I'm going to check the abdomen. No mass felt. Okay, any pain?
No.
Okay, so there are no pains here. The stomach region is nicely built. Is okay. Patient had no pains when I palpated it, and I did not feel any lumps, bumps at all. Thank you very much.